literally at age 1, as a dentist, you can help the journey. You can help the formation of a child's face. You can help the dental arches. You can help the direction of their quality of sleep. So many beautiful things in a growing individual are at our fingertips. So to give you a simple example, the style at which a child swallows is very critical for how their face starts to form, or how their sleep quality might be. So if the tongue does the right thing and goes in the right place, that child will have better sleep, they will have less speech problems, they will have less behavioral problems. So many things will be easier in the journey of parenting for, both parent and child. So,
so early on, you're looking for those habits, the swallowing habit, or other
airway obstructions, mouth posture, swallow patterns, aberrations inside the nose. It might be allergens, it might be enlarged turbinates. There's a lot that you can assess. Essentially, the mouth is our expertise, but the nose is intricately linked with the mouth. So, the smaller your mouth, the smaller the space inside your nose. So your breathing is going to be restricted if your mouth is small, and that's, an obvious way you can help a child get better airing.
And how do you approach craniofacial growth problems? What outcomes matter the most to you beyond the straight teeth? You might have already answered a bit of this.
Yeah, so essentially the jaw, particularly the top jaw, finishes its growth by age 10. So if you think about that, you've essentially got a few years where, your child's in primary school, they're compliant in the chair, and there's lots you can do to, optimize that growth potential so they reach what genetics had determined for them. So 10 sounds really young, but beyond that, the maxilla is not going to grow on its own anymore. So you pretty much
so the maxilla being the top jaw.
The top jaw, yeah. And the top jaw usually dictates what the bottom jaw does, because the top teeth sit over the bottom teeth. So essentially the top jaw is the boss. We always talk about that. So we want to make sure that that's doing the right thing. It's at the right size for that 10-year-old, or leading up to it, that it's going to get to the right size. Because a lot of the new teeth are sitting there patiently trying to find space to come in and not need orthodontics. I mean, that's the beauty of early intervention. You can really reduce the time a child may be in orthodontic treatment, or the outcome of that.